Welcome to Dr. Tuchine, and in this video we are going to talk about how to take the history of swelling and also the examination. Okay, so let's get started. This is a detailed video. So first of all, like every history, we will start the history with biodata. We will ask the patient name, what is the patient age, and is the patient is married or unmarried, or what the patient do. Okay, next, like the chief complaint, what, okay, past dental history, medical history, family history, personal past, and treatment history. Okay, next is components. I will discuss it one by one. Okay, so if history of swelling I will discuss later. Next, pain through, we need to ask past dental history. What we ask in past dental history, we ask if the patient have done any or gone through the extraction, scaling, filling, or any root canal procedure, or any prosthesis near like bridges or crown. Is also important, like if the patient smokes, or alcohol consumption, or there is tobacco chewing habit, or what is the diet of the patient. Next, we had needed to ask the history of chronic disease and the treatment to be asked also. So next is family history. We asked then we will ask what is the treatment the patient received, what is the kind of treatment and nature of treatment, okay, and the duration to be clarified. So now, history of swelling. So the questions we ask the patient in history of swelling is swelling is present since birth. Okay, if the duration of the swelling is shorter, it is suggestive of inflammatory and painful. And if the shorter duration and rapid growth, then it can be malignant. See, okay. And if the longer duration but not painful, it might be neoplastic or benign. Next, mode of onset. It is also important, like when it appears. Okay, if it appears immediately after trauma, it can be hematoma, or if it develops spontaneously and grow rapidly, it can be inflammation, or if the swelling is growth is steadily, that can be malignant. And if the swelling is very slowly, like onset is very slow, it can be a benign growth. Next, we ask is exact size of the swelling and the shape of the swelling. The patient noted any change in the shape or the size of the swelling. So, in the progress of the swelling, we will inquire about the swelling slowly or remained stationary. Like there is no change in the swelling, like it remains same. Okay, and it can indicate, so we can indicate what is this? Is the malignant transformation of a benign tumor, or it is a malignant or benign, like these. Okay, so next is pain history. So for taking pain history, we will go with the Socrates, like as for site, we'll ask where it is located, the pain where it is, look if it is localized or generalized, or it is referred, or the pain is throbbing, dull, or aching. If the pain of the swelling is throbbing, it may suggest inflammatory lesion leading to suppurate. Okay. Next is pain. If pain is before swelling, it can lead to inflammation. If the swelling before pain in growth can also be leading to, the pain is absent in benign early carcinomas. So when pain appears in carcinomas, it signifies complications such as ulcerations, infiltrations, involvement of nerve. Next, pain next history is next examination, that includes all examination, which includes all the one inspection, palpation, percussion, and auscultation one by one. So in inspection, what we ask, we have to see the number, the site, the shape, the edges, surface, color, and skin over the swelling. So all these things we have to see in inspection. Next is palpation. What we need to do, we need to check temperature, tenderness, extent, position, edges, shape, consistency of the swelling, fluctuation, transillumination. Okay, so in examination it includes all these components. We have to do inspection, we have to do palpation. Okay, so the next is percussion and auscultation we need to do also. It includes in the examination of, okay. So next is like inspection. So now we are coming to the examination part of the swelling, and it includes inspection. So in inspection, we are not asking question, we are examining. Okay, we are looking what are the changes, inspecting it. So first of all, we will look the number. Okay, So how many swellings are present? Next is site, where it is located. Next is shape. What is the shape of the swelling? Like it is ovoid or spherical or irregular or pyriform or pear shaped. Next we will look if the swelling, what is the color. So by looking at the color we can suggest what it is. Like it is red purple, it can be hemangioma. It is blue, then can be ranula. Black, it can be melanoma. Okay. Next we will look is surface. The surface is smooth, lobulated, nodular or irregular. Next, we will look the edge. Inspect the edge. How is the edge? It is circumscribed or it is diffuse. Next is base. The base of the swelling is pedunculated or sessile. Next is skin over the swelling. What is the skin? The skin is smooth or discharged or engorged vein or visible pulsations. There is then pigmentation, any scar formation. So next is palpation. After inspection and examination, we will go for palpation of the swelling. So we have to do this, okay? So by palpating, we will know about the temperature. There, this temperature is raised. If it is raised, it is inflammatory swelling, okay? And we will do it with the back of the hand. Next is tenderness, like the pain, the swelling have pain, and we will palpate, okay, gently, and observe the patient face while palpating. Next is we will look for the position, size, and extent. We will feel all around the swelling and estimate the depth. Next is surface. By palpation, we can also know the surface, like it is smooth, cyst, or lobular, lipoma, or nodular mass of large lymph node, rough or irregular, okay, like in case of carcinoma. So next is translucency. We can determine the fluid inside the swelling is clear. Swelling contain fluid inside, for example, in case of ranula or meningococcal. So next is consistency. The swelling is soft. It is lipoma. It can be lipoma. The cyst or chronic abscess. It is firm. It can be fibroma. If the swelling is stony hard, it can be secondary carcinoma of lymph node. And if it is bony hard, it can be osteoma. So by looking at the edges or margins, it is like diffused or fine and fluctuation. So in palpation, we fluctuate the swelling. So it is a valuable sign indicating the presence of fluid within the swelling. And it happens when the pressure is applied to mass on one side, a transmitted impulse felt on the other side. So So next is what eating. Auscultation. Auscultation should be examined with a stethoscope. Okay, whether it is diastolic, systolic, or it's continuous, we need to check it. Percussion. Percussion is done to differentiate the gaseous swelling from fluid swelling, and resonant or dull to elicit tenderness over bony swelling. So, in examination, we also palpate lymph nodes to identify or to know any lymph swellings. Like we start from submental to submandibular, then palpate tonsillar, then parotid lymph node, and preauricular. As you can see, the green dots, let me mark it. We start from here and then palpate preauricular, and then postauricular, and then occipital, and then superficial cervical, then deep cervical lymph node, posterior cervical, and supraclavicular. So it goes like this all the way down.